Leprosy may be the disease that brings back memories of Bible stories, but it is as real as the people suffering from it. Although it is rare and treatable, patients who received treatment at the Alupe Center in Busia in the 1950s decry the lack of drugs that has caused the disease to recur. Well, this comes at a time when the National TB, Leprosy and Lung Disease Program has discovered a remarkable number of new cases in some counties. As Mashirima Kapombe reports, although the disease is rare, it continues to cause high morbidity among those affected.
The surroundings of the KEMRI Center for Infectious and Parasitic Diseases in Alupe, Busia County are calm and scenic. Over 70 years ago, leprosy patients from across East Africa found refuge here.
This center started in the late 1940s because of leprosy. At first, this leprosy, it was known as a curse kind of a disease. And most patients who used to come here, they were brought by their relatives, but they were just like dumped here. After getting well, these people, they were unable to go back to the community. But with time, because of research which was being done at that time, people started getting treatment and they started getting well.
Rejected by the community, some of those still living found a place to call home near the center. 79-year-old Efeli Ambio started ailing as a teenager.
Ugonjwa ikaanjia kwa mkui. Alafu mkui akakufa tanji. Hapana tembea anakufa tanji. Alafu ndio ikaenda namna hiyo nauma ikaleta kitonda hapa ndani. Alafu mimi hapana kiwa ni ukoma, hapana hata mama hapana kiwa ni ukoma.
The doctor attending to her at a health facility near her home in present-day Kakamega County referred her to Alupe.
Takitara kachukua mimi akasema kupeleke mahali naitwa Alupe. Na wasungu nakuwa hapa. Mimi nakaa mita yenye nafuaka hata miaka 3 namna hii. Kama unapoa kitoko wanakutoa unaenda pumsikia hapa. Ni wenyewe batakuleteanga chakula, daktari wenyewe anasaidia sisi.
A stone's throw away from Efeli, we meet Benedetta. Originally from Kisumu, she came to Alupe in 1974 after she was diagnosed with leprosy.
Ugonjwa ilisika mimi kama bado tu msichana. Daktari aliandikia dawa hiyo naita DDS. Na hii mafuta ya kupakapaka hiyo ilikuwa naita angakali. Mwenye wasungu ilikuwa nayo. Ugonjwa nikakuwa mzuri.
Leprosy is caused by a progressive bacterial infection whose symptoms may not appear for as long as 20 years after infection. Although not highly infectious, close repeated contact with an infected person over a long period of time can lead to contracting the disease.
Leprosy mostly affects the skin, but if it's not treated at the right time, normally people end up losing the fingers and the toes.
The community of leprosy patients in Alupe is close-knit. Having met at the center where research was going on for years, they grew close, often visiting each other even after Kenya was declared leprosy-free. Saulina is one of the patients we met who stayed at the center longest.
Katibiwa hapa mwaka 20. Sasa hao akawacha sasa maneno ya kutibu sisi wote wa leprosy. Anasema ati ugonjwa ya leprosy amekwisha sasa hakuna.
In 1989, the World Health Organization declared that Kenya had successfully eliminated leprosy by reducing prevalence rates to below 1 case in 10,000 persons. But that declaration left a gap that is now felt by those affected.
Hiyo mwaka 20 yote tulikaa kama iko msima natembea naenda hata Busia na bila likuja nilipona na bila toa sisi kwa dawa ndio mimi naongezeka ugonjwa naongezeka sali hata hakuna namna.
Nilikuwa tu mzuri, nilikuwa tu mzima. Tukujua kama anaweza kukatika mkono. Kukatika mkono, ulianza tu kama mzee pia imekufa.
Over the years, leprosy is a disease that affected very few people. Even in biblical times, the most prominent story would perhaps be of the 10 lepers who were healed by Christ, and only one came back to give thanks. Although science has made the disease curable, those affected in the past claim unavailability of drugs and support has taken them back to the years the disease ravaged them. Listed as one of the neglected tropical diseases, leprosy affects the very poor in society. Because of its effects on the limbs, it robs those affected the ability to earn a living and traps them in a cycle of poverty and disease. Despite the WHO developing a multi-drug therapy to cure all types of leprosy in 1995, it is unavailable to most, yet it is free of charge.
Hakuna dawa. Kuenda hapo hospitali maelfu. Hata mimi tangu hao nasema ati hakuna dawa. Hakuna jina yangu hapo kwa listi ya hospitali hakuna.
Those who have lost their limbs in Alupe are calling on the government to do more to ensure those in close contact with them do not suffer the same fate if infected. Mashirima Kapombe, Citizen TV, Busia.